Hello, I'm Matthew Taylor. I'm a psychiatrist working in the UK, currently based in Oxford. And as I presented at the ECMP in a Lundbeck-sponsored symposium, I believe that we psychiatrists should, as clinicians, be improving the way that we assess functioning in our day-to-day clinical practice. All of us working with schizophrenia realize that impaired functioning is a very common clinical issue. In a recent international study surveying psychiatrists across Europe, the Middle East, and other countries, we found that among patients being seen by psychiatrists, the majority, over 2/3, 70% in total, had impaired or very poor functioning in their clinicians' view, and only a minority were functioning well. And this is not surprising. We know that working with functioning is an important treatment goal. Here we see summarized the treatment goals by phase of illness for schizophrenia from the recent WSBP guidelines. And as we can see, the goals of treatment vary by phase of illness. When someone's acutely unwell in a hospital setting, we often reasonably focus on symptom control, reducing distress and behavioral disturbance. But as their condition improves, as they're becoming more stable, while we do want to avoid relapse and return of symptoms, and also monitor closely for side effects, we're also reasonably looking to maintain and even improve their functioning and quality of life. And what do we mean by functioning? Well, we increasingly recognize that functioning is not a single concept. For people with schizophrenia, there may be strengths and weaknesses, relative impairments across many different domains. These can include social functioning, our ability to be a spouse, a family member. It could be the cognitive impairments we see in working memory in some cases, our ability to work socially and adjust to community living, our psychological profile, our behavioral and emotional skills that affect our ability to achieve our goals within the environment, our ability to carry out everyday tasks, or even our vocational aspirations, our ability to return to education or employment. So how do clinicians in the real world assess functioning? Well, in that large international study, what we found was the vast majority of us simply assess functioning in our clinical interview in an unstructured fashion. And that's what over 80% of us do typically. And a minority of people are assessing functioning using standardized tools. Unfortunately, the tools that we're using, where we do use tools, are what we call global measures. Things such as the Global Assessment of Functioning, the GAF scale, which is very well understood, very well respected scale, but which boils down functioning to a single measure. It's a global function between 0 and 100. And unfortunately, that does not allow us to really understand individual differences in the profile of impairment. Other tools called multi-domain tools allow us to get a more detailed fingerprint, and that can support individualized care planning. And for individual patients, what we realize is their particular functional goals will be individual to them. And by using tools to help us explore their particular pattern of strengths and weaknesses, we can guide our care more accurately, whether through formal functional remediation or just better informed general clinical practice. So optimizing functioning is an important treatment goal for us in schizophrenia, but most of us still assess functioning through unstructured clinical interviews. Using structured tools can give us a better profile of our particular patient's functional impairments, and even looking to the future, there's a potential for technology, smartphones particularly, to allow us to get richer assessment over time. Thank you very much.